Hello, my name's Lauren Collins. This is going to be my IVPB competency. So the first thing I'm going to start with is I'm going to compare my orders to my MAR. I have gentamicin 80 milligrams IVPB every 8 hours. I also have that on my MAR, so we are good there. With this, you'll do a math problem and you figure out that if you have a pump, you'll do 50 milliliters over an hour, or since we don't have a pump, we'll be doing 13 drops over each minute. So we'll do that. Now that I've checked that, I'm just going to look at my drug book and make sure everything is good. So our normal dose range is 3 milligrams per kilogram of body weight in 24 hours divided over 3 doses, so we are good there. Our dilution, it comes in different ones, 50 to 200 milliliter bags. We have a 50 milliliter bag. Our rate of administration over 30 to 60 minutes, so we're also good there. And then precautions, we need to watch for anaphylactic reaction, and it's also nephrotoxic, so we have to be careful with that. We're gonna need to watch the urine output and BUN and creatinine as well while we infuse and after. So now that we've done all of that, I'm going to check my medication against my MAR. I have gentamicin 80 milligrams in 50 milliliters, so that is the same. So now that I've checked this, I'm going to make sure also that I have my same patient on my orders and my MAR, same patient, same hospital number, also check their allergies. And as I said, when I did push, they don't have any allergies, so we're good. Now that I've got that, I'm gonna prepare my equipment. So I'm gonna wash my hands. Very good. And I'm gonna get my tubing. So I'm going to first grab out that. We're going to need that when we go into the room. Now my tubing, I am just going to go ahead and prime it before we go into the room. So, I'm just gonna clamp this off while I fill up my chamber. Make sure that's there. Okay. So my chamber's full. Now I'm just going to unclamp my tube and let it slowly run through. And we have no air bubbles in the line, so we're good to go to the room. Now that we have that, we just are going to label it before we go in. So I still have my cap here, so we're not going to contaminate anything by laying it down. Just gonna put on here gentamicin 80 milligrams, and then I'm going to initial on it, and we're going to take that into the patient room, and then once we get in, we'll label the start time. So I'm gonna put that on the bag, and we're good to go in there. So before I go in, or as I'm going in, I'm going to wash my hands. I'll put gloves on, and then I'll introduce myself to the patient and explain the procedure. So, hello, my name's Lauren Collins. I'm going to be giving you some gentamicin today through your IV. It's going to be a piggyback, so it's just going to run like the other ones have been. With this, I just want you to tell me if you have any sort of reaction, rash, swelling, redness, or any discomfort. Just let me know, and I will, of course, come and check on you. So We're also going to be monitoring that stuff that we said before with this. I'm going to ask the patient their name and their date of birth, and I'll check their armband. That is the same as what they say. I'll also ask them if they have any allergies, and they don't. It's the same as their MAR. So we're good to go in hanging this. So I have this solution here. I'm just going to go ahead and hang this one. And I'll clamp off my primary for a minute. And then before I do that, I'm just gonna make sure that I have good blood return, that the line is patent. So it is, so I'm just gonna clamp that off, and we will hang this bag lower than the gent. Okay. So now that I've done that, I'm gonna identify the port closest to the primary bag, and I'm just gonna clean it for 15 to 30 seconds. So that would be this port here. Gonna clean that really good. 15 to 30. Then I'm going to hook my piggyback solution to this port here. Then I'll unclamp my piggyback's secondary tubing, and I'm going to regulate with the primary tube. And I've discovered that this arm, it does not flow into this arm with all clamps unclamped. So I'm going to unclamp it and just put it into the garbage can to regulate my drops. So these gloves are way too big. So now I'm just going to regulate everything, make sure everything's unclamped. Okay. Okay, I'm ready now for you to count. So when I say go, we will start. So go. All right, and that was 13 drops in a minute. So we've regulated it and it will infuse into the patient. We'll continue to monitor for any reaction, and we'll monitor that BUN, creatinine, and their urine output because of the nephrotoxicity precaution. So there's IVP back.